Today, I am going to explain how to prepare vegetable dishes for the chronic kidney patients. Across the globe, in the same principles, whatever the type they want, they can prepare. Most important thing is, after boiling in the cooker, all the ingredients, whatever I am going to explain, the released water has to be taken out. Thereafter, the solids, we have to give tempering for good aroma and taste with half a teaspoon to 1 teaspoon, in the sense 2.5 to 5 gram ghee or butter or cold pressed edible oil with green chilies and chopped onions. The patient has to use 1 gram salt only for the entire dish while eating. So now, what are all the vegetables can be prepared for the chronic kidney disease or any other patients? I am telling you, these vegetables are having enormous medicine values. Only the thing is, we have to remove the potash. So after draining out the released water, so automatically the entire potash content comes out. So now here, any vegetables can be used. Some people are saying that tomato should not be used, that too with seeds it should not be used, and below ground it should not be used. Nobody has experimented on their guardians, father or mother. I have experimented on my father. So 100% it will not going to be affect to the chronic kidney disease patients. In my diet and treatment protocol, they will permanently come out from the chronic kidney disease. Even if their eGFR is less than 10 also, it will become normal. In dialysis also, improvement will be taking place according to the period of dialysis. So that's why the preparation of vegetables, what I explained, is like a normal food. It has to be prepared. The released water after boiling should be taken out in the cooker. So thank you.